If there is one thing that both the provincial NDP and the provincial Conservatives can agree on, it is the belief that, to some degree, involuntary care is part of the solution to the mental health and addictions crisis. Now, Premier David Eby made that clear last week, a few days before Conservative Party leader John Rustad released a statement of his own defending the practice. Well, a couple of other local governments have also spoken out in favor of this approach. Here is Squamish Nation councillor Wilson Williams speaking at the announcement last week.
We are in the throes of a toxic drug crisis. In recent years, I can hear the leadership in BC Indigenous communities that have lost so many people to suicide, mental health issues, addiction, substance abuse, social challenges. Our people have been waiting and very grateful for the progress we made today with the city here in Vancouver, with the province. We need more supports. We desperately need more resources and room and doors to walk into to create these partnerships. Much more needs to be done, but today, this is a significant step forward for all.
That is Squamish Nation councillor and spokesperson Wilson Williams speaking in support of involuntary care. And Councillor Williams has been good enough to join us this morning. Good morning to you.
Good morning, Stephen.
Thanks for being with us. When you spoke with David Eby, or when you were alongside David Eby at that announcement, you mentioned the overrepresentation of Indigenous people in prisons and the higher rate of suicide and addictions. And we know that overdose deaths, of course, outpace the non-Indigenous population by about 5 to 1. Why is involuntary care, do you think, a solution to this?
You know, when we looked at it, most importantly, it was about strengthening our relationships, with the provincial government, the local municipalities, and really looking at opportunities and options that best meet our needs. But at the same time, we walk gently because we know that Indigenous care, healthcare, whether we're down that road of involuntary care, it has to meet the needs of our Indigenous people and the comfort for them.
And who do you see being the subject of involuntary care? What would it take for somebody to be admitted to involuntary care?
Yeah, when we looked at the details, with highly, I would consider patients who are, meet that need of mentally unstable or mentally ill, due to drugs and so on. But I think that when we look at it, there has to be, some kind of criteria worked with the Indigenous people and healthcare in regards to what identifies them as well. I think we're on that road to what that is, but there's a lot of work to do.
And is there a difference between the way the general population ought to be considered or treated and the what would be culturally appropriate for various First Nations when it comes to treatment?
Yeah. Can you say that again?
I'm just saying, would you, as a Squamish Nation person, would you be looking for treatment that would be culturally appropriate as opposed to, the treatment that the general population, the non-Indigenous population would receive?
That would be the most important thing. It's threshold with a lot of services used by Indigenous people. I think there's still very numerous amount of challenges that our people face, whether it's in the court system, incarcerated, in whether they're adopted or whether they're patients in the hospital. So this is a big rise amongst Indigenous people and leaders throughout Canada that we got to meet the mark that's that adequate care for our people.
Councillor, this is not a new problem. I mean, this has been going on for a long time, and we know the number of drug deaths we've seen since 2016, since this was declared an emergency. And as I said, we know that Indigenous people outpace the general population by a long shot when it comes to the number of people who have died as a result. We're a month away from an election here. I mean, what do you think about the timing of all of this?
Yeah, yeah, we thought a lot about the timing. There's other things we've worked on in big initiatives at the forefront of the you know, before elections. But when we look at our future, when we plan ahead for our people, we need capacity in our Indigenous community, our Squamish Nation. We need to, open doors for our people to become physicians and doctors and
Mm.
specialize in mental health, specialize and, have our own dentists in the community, building our own economy where, that pride's there, but at the same time, we're incorporating preventative measures to not reach this state of type of healthcare, especially down the next 10, 20 years.
Hmm. John Rustad, of course, who heads the BC Conservative Party. I mean, it seems both parties are on the same page here. Both the NDP and Conservatives say that they would like to see secure facilities where people can be treated. You support both parties on this, then, do you?
Well, without the fear mongering and all the election propaganda going on, they both support the direction here.
Yeah.
But I think, when you reference in all the strategic measures and research that's done with specialized doctors in this, we're looking at what kind of services are required to help certain individuals.
Mm-hmm.
You know, that's the line we're down. I think, minus the election stuff, I think that, there's a need here and we got to be in the room to be able to have this dialogue or else we would be overlooked.
John Rustad also said in a news release over the weekend that his party would recriminalize hard drugs and shift the focus toward treatment and recovery. He also said that he would, and this is a quote, increase police presence and restore law and order, ensuring drug dealers and criminals are taken off the streets. Given the high rate of incarceration among Indigenous people and the high rates of arrest as well. What do you make of that approach?
Yeah, if it's part of the platform, that's his notion. But I think when we look at, what care best meets the needs of Indigenous people, if we're looking at separating that, but overall, when we look at life expectancy amongst Indigenous people, it's 14 years less than the general public, and these stats are glaring at, Indigenous leaders today. We have to do something ourselves, but at the same time, create these relationships that are meaningful. So we're in the rooms to, just like the Nachanos, we've declared a health crisis as well due to the toxic drug crisis and in our community. We're losing young people at a pace we've never had before. So it's paramount that we are involved, but have our voice as well, but plan ahead for our own communities.
John Rustad also says that he would close, there are about 80 supervised injection sites across the province, or overdose prevention sites across the province, as some of them are called. He says that he would close all of them. Is that something you're in favor of as well?
No, I wouldn't say that. No, I think there needs to be, reporting done, some research done. I'm interested to see statistics in regards to how these safe injection sites are working for the general public, for Indigenous people. When you look at the downtown east side, that's overpopulated with Indigenous people and urban Indigenous community that are displaced and homeless. And I think that is either doubled or more since COVID and the cost of the living and inflation. So, people are sort of imposed and forced into a lifestyle that they came to Vancouver hoping not to be living that way.
Do you feel, Councillor, that First Nations have enough of a voice when it comes to an election campaign, or does that voice get lost, do you think?
When you look at the province here itself, and there's over 260 identified First Nations communities in BC alone. It's the largest in Canada. I think, no, there's there's rural communities, there's city indigenous communities like ours. We need to look at working together in a way where it's the equality's there, but at the same time driven by the fact of we are all in a health crisis. We need to look at using our voice collectively, not just with the province and municipalities. We need to be knocking on the federal government's door as well, how paramount it is for us to look at how we mitigate some of these challenges we're facing in our community, which is daily. And, crime rates are up in our community. Things that are occurring that we've never seen before due to mental health issues, and whether it's drug psychosis and so forth.
Counselor, it is really good to hear you this morning. Thank you so much for taking the time with us. We appreciate it.
Thank you for having me. Have a good day.
You take care. Bye-bye now. That is Wilson Williams. He is a Squamish Nation counselor, and he was speaking. He was with Premier David Eby at the announcement over drug treatment over the weekend.